This is Microdont. What do we understand by term Microdont? Microdont refers to the tooth that are smaller in size. And in this picture we can clearly see on the left hand side normal tooth is there. On the right hand side clinically we can figure out a smaller tooth. Microdont, there are basically three types. True generalized microdont, in which all the teeth of the jaws are smaller in size. Relatively generalized microdont, in which normal or slightly smaller than the normal tooth, which gives the illusion of the true microdont. Then a single tooth microdont. It basically affects the lateral incisor and the third molar. We call rhizomicry and microdont. Both are smaller in size. Then what is the difference between them? Microdont, that is smaller in size, as a complete both crown and root, while the rhizomicry, only the length of the root is smaller than the height of the crown. In the center we can see normal tooth with a normal crown size and the root. On the left hand side microdont, in the clinical picture we can see clinically the crown of the tooth is smaller. In the radiograph we can see the crown and the root both are smaller in size. While on the right hand side rhizomicry is there, in which only the root size is smaller, which clearly sees in the radiograph, in which the crown size seems to be normal while the root size is smaller in size. What are the clinical features? Usually the maxillary lateral incisors and the third molars are involved. Supernumerary tooth are smaller in size. Root of such tooth is also smaller. We call maxillary lateral incisors are normally microdont, which is also known as peg lateral. What are the complications? Since the tooth size is smaller, which affects the spacing in the mouth, it also causes shifting of the other tooth over time. Because tooth is smaller in size, it also affects the bite. Here is a case of microdont. A 30-year-old male patient reported to the Department of Oral Surgery of Lighthouse Campus, Mangalore. He complains of pain in lower left back tooth region. He got his tooth extracted on 29/11/2022. On taking the RVG of the extracted tooth, an open apex microdont is reported. Pathogenesis of microdontia. During development, bud stage and proliferation is reduced. It was presented by Dr. Shipra Gupta and Dr. Tuhina Khatri from the batch of 2017.